So a very warm welcome to everybody who has just joined. We are here today to discuss the UCL Paediatric Neuropsychology Masters and PGDIP programs. We have two routes, which are the applied and clinical routes, which I'll come on to in a minute. But first, we just want to introduce ourselves. My name is Dr. Zara Jessup. I am one of the program co-directors. I'm a consultant paediatric neuropsychologist at Great Ormond Street Hospital, and I'm an associate professor at UCL. I'm going to hand over to my colleagues to introduce themselves.
Hello, I'm Frédérique Liégeois. I'm the other co-director for this program, and I'm a cognitive neuroscientist and associate professor at UCL in the developmental neuroscience department.
And hi there, my name is Rhonda Booth. I'm an associate professor in teaching, and I'm the module co-lead on most of the modules on the Paediatric Neuropsychology program. I'm a research psychologist by training, and also your teaching fellow, so the main contact, one-to-one contact on the program.
Exactly, thank you.
Warm welcome to everyone, wherever you are in the world.
So today we're just going to have a quick run through an overview of the program and give you an idea of a few sort of key pieces of information about the program, or the suite of programs as we often think about it. So we're going to just give you an idea of what to expect and how things are run, and also what it is that we offer. And as we mentioned just a few minutes ago before we started recording, we'll give you an opportunity to ask questions at the end, which will be an unrecorded section of the evening or afternoon or morning, depending on where you are. So to start with, I'll just advance our first slide. We are situated within the Great Ormond Street Institute of Child Health, which that's the main building, as you can see there. As I say, this is Paediatric Neuropsychology, and we offer the program both as a master's and as a postgraduate diploma, depending on your needs and also which route of the program you end up studying with us. So as I mentioned before, there are two main routes to the program. There's a clinical route and an applied route. I'll come on to talk about the modules and the structure of that in a minute, but most importantly, I think we just want to cover what paediatric neuropsychology is. So hopefully for those of you interested in the program, this will be very familiar to you, but really what we're talking about is a subspecialty within the field of clinical neuropsychology, and we are studying the relationship between brain health and behavior in children. So really those brain behavior relationships are the core part of the work that we do, whether that's in a clinical setting or in an academic setting. And as I mentioned before about the two routes of the programs, if you study with us as a postgraduate diploma, that is available on either the clinical or the applied route, but only for a certain sort of subset of applicants. That includes 8 compulsory taught modules. Whereas if you study the master's, which is available to all applicants, then that's 8 compulsory taught modules plus the research portfolio. And the important thing here to say is that different routes will be appropriate for different students, depending on where you're at in terms of your career development and your studies. But the programs are taught together. So although you are divided in applications and also in enrollment in the programs in 2 separate routes, you are taught as a single cohort all together. All assessment is the same, all teaching and learning opportunities are the same, and all outcomes are the same, whether you are on the clinical or the applied route of our programs. So in terms of who our program's for, the applied route is for graduates with a minimum 2-1 undergraduate degree in psychology or an international equivalent. Sometimes some of our students will have a degree in psychology and something else. If you're not sure if your particular degree might meet the requirements, you're always welcome to get in touch with us. We can't necessarily say for certain on a case-by-case basis, but we will certainly try and give you a steer. But the really important part is really that psychology component. And the reason for that is we want to make sure that our students all start with the same kind of baseline knowledge and understanding, so that then the concepts and the information that we're imparting via our program is appropriate to you and at the right level. And then for our clinical route, that's open to qualified clinicians who are HCPC recognised as either UK clinical or educational psychologists at the moment. If you are a counselling psychologist and you're interested in applying, please get in touch with me directly and we can have a conversation about that, because I'm aware that that is an area that might be of interest to some of you and might be relevant. So in terms of how you can take the programme, at the moment, only the postgraduate diploma can be taken part-time over 2 years, and we'll come on to talk a bit more about the structure of the programme in a minute. But the applied students generally will be enrolled full-time within our programme, and that's predominantly our MSc students. And so as I say, we would expect that programme to be taken within 1 academic year. And the clinical route, just to say, is the only BPS accredited programme which fulfills the paediatric knowledge component for the UK training in clinical neuropsychology. So some of you will have heard that mentioned as the QICN, which is the BPS's version of the qualification in clinical neuropsychology. And there are also a number of university-based routes now as well. So this may be something about which you know loads already, and that might be why you're with us today or considering applying to the programme. But again, if that's something that you'd like to find out more about, there's lots of information available on the BPS website as the sort of repository for information about training in clinical neuropsychology. But I'm happy to answer questions about how our programme fits in with that, if that would be helpful. Well, I'm going to hand over to Frederic.
Yes. So in terms of the content of the program, our purpose is really to give you training and knowledge in brain behavior relationships. So we have modules covering more clinical aspects, but also modules covering more cognitive neuroscience knowledge. And after you graduate, you will be able to demonstrate this knowledge and also apply it, which is key to your next step. We are preparing students really for doctoral studies, either clinical or PhDs. So this is the sort of level that we are trying to target in our teaching. So in terms of practical questions you may have, this is a full-time in-person course for the applied route, and it could be taken over 2 years for the part-time students. The way we teach the modules is in blocks that last for 1 week. Roughly, teaching would start around 9 o'clock and finish around 5, Monday to Friday. So this allows our clinical students to take 1 week off their work if they're working and attend in-person teaching at UCL. You also have to be present for the in-person exams that we run, and there will be also some help sessions and workshops running in between those, but this is really the core. And it's worth mentioning that the 8 modules are also all compulsory and the same. There's no optional modules, so everyone is taught together, as Sarah mentioned. So typically the teaching would last from October to June. And then June, July, August, you would spend on your research projects if you have enrolled on the master's route rather than the PG dip. And part-time students don't really work part-time as such. They just do the same, but over 2 years. So they would attend modules 1 to 4 during the first year, and then 5 to 8 during their second academic year. So even though it's called part-time, they will really have the same workload as those students who are registered full-time. So this is really important to bear in mind if you have other commitments and you want to join the course. So this is a typical timetable, just to give you a flavor of how busy you might be, and that's why we call it a full-time program. So roughly speaking, we have those teaching weeks almost every month, as you can see here at the top. And we also have assignments. We have 4 unseen exams and 4 pieces of coursework that you will have to submit during the year. So as you can see, every month you'll be busy either attending teaching for 1 full-time week or revising for an exam or preparing for your coursework. And if you're enrolled on the MSc, you will alongside work on your project, and especially towards the end of the year, you'll probably be more present working on your research project that will be supervised by an expert in the field. And this is usually submitted at the end of August, and then we have oral presentations in September. So you are registered for a full academic year, but if you are on the PG dip or only taking the top module, then all the assignments and module teaching will finish in June. However, if you have to resit some assessments, the late summer assessment is in August. So you would have to come back if you haven't passed some of the modules during the year.
So these are just the names of the 8 compulsory taught modules, just for you to have a look through and get an idea of what we cover. And also here are some questions that we try and address through these modules as well, just to give you a bit of a flavour of the type of the topics that are covered and the questions that we are interested in. So you might notice that just the ones there in blue would say they're more clinically driven modules. So they're the ones that we may discuss case studies or really apply the knowledge of the neuroscience that are covered in the 4 other modules in black. So you can see we have a bit of a balance. So we have more of a neuroscience type of a focus module, so followed by more clinical applications. And research
if
project.
if you're an MSc student, you have a 9th module, module 9, which accounts for 60 credits, so out of 180, so that's a third of your degree. And so what you'll be doing is working on a project that is supervised by either a clinician or a cognitive neuroscientist from UCL or from Great Ormond Hospital or elsewhere, and you will ask a brain behavior question during that project. This will be assessed with a large written portfolio, around 8,000 words submitted at the end of August. And then there will be an oral presentation where you will present your work as you would do maybe at a conference, and then with a question and answer session to assess your understanding and your knowledge of what you have written. So these are some examples of research projects that we've had in the past. This is not an exhaustive list, but we've had projects looking at pediatric brain tumors and the cognitive profiles in these conditions, the long-term effect of preterm birth as well, hypoxia, epilepsy surgery, because Great Ormond Street Hospital has a big epilepsy surgery program, so we have quite a few projects on that topic. Other students have worked on with children who have sickle cell anemia, visual impairment, but also genetic syndromes and more widespread neurodevelopmental conditions such as autism or ADHD. So we could have projects that focus mainly on the cognitive profiles, but also projects that are looking at brain imaging. So in terms of the skills you might develop, here are some examples. You might develop skills to analyze structural MRIs of children who have neurological conditions. You might learn how to score parental questionnaires, ERP, MEG, diffusion-weighted tractography, or classical neuropsychological assessments, face-to-face interviews with children, or data analysis softwares. These are the sort of skills that you would then leave the masters with. And these are really applicable if you plan to carry on for a doctorate or PhD or any type of job where you'll have to analyze data, whether clinically or in a research setting. Shall I carry on? So these are just some quotes of our past students that maybe I'll leave you with a few seconds to read. But in general, I think our students like the fact that we have those 2 half cohorts taught together. We also have external lecturers who are specialists in the field, either clinicians or cognitive neuroscientists, so you will learn about the latest research in the field. People find our course engaging, and you will learn your anatomy as well as neuropsychology more in depth. So these are just some examples of feedback we've had in the past.
So thinking about what happens after the programme, there are a number of different graduate destinations, which obviously depend on where you're at in your stage of your career in any event. So for our applied students, often they'll be going on to research assistant posts, sometimes to assistant psychologist posts, either within the NHS or, for example, within the third sector. Some students will go on to do a PhD after they complete their MSc with us. We've had quite a few students who've gone on to do that, some within UCL, continuing there, and some at other universities. Some students will then go on to pursue a doctorate in clinical psychology. So that might be the next step, depending on what you've done leading up to taking this MSc with us, if you've had the opportunity for some clinical experience already. And then for our students who are on the clinical programme, some students will have a change in career, moving from a more, say, community-based kind of clinical psychology or educational psychology role into a more specific clinical neuropsychology post. So that's been the case for quite a few of our students who've completed the programme on the clinical route, so that they've been able to then make a transition into a more direct clinical neuropsychology role, either within the NHS or, again, within another sector. It's also the case that many of our students go on to undertake training in clinical neuropsychology. So on the formal route, either, as I mentioned, with the QICN and the BPS route, or in one of the university-based routes. So as we said, we are the programme that confers the knowledge component for that suite of requirements that go with that sort of training. So that's one thing that people can gain from in terms of studying with us on that clinical route. But just a reminder that it's only the clinical route that is accredited at this time. The applied route, although you take it at the same time and under the same circumstances, is not technically accredited by the BPS. So it's really just that postdoctoral component that applies if you want to use it as part of your training in clinical neuropsychology.
So we're very proud of our research, as you know, at UCL, and we've had many students in the past who've been able to publish their work, either the work that they carried out as part of their research project, but also we have students who publish their coursework in peer-reviewed journals. So these are some examples of topics and peer-reviewed international publications that have come out, just to give you a flavour again of the range of topics. So we have systematic reviews, neuroimaging, intervention projects, profiles, and also more neuropsychology-based papers. So you've probably chosen UCL because you know it's famous for its research, and it was awarded University of the Year in 2024. And these are just some quotes. We do try and encourage our students to take part in everything that is happening at UCL in terms of research in psychology, neuroscience, attend seminars. There is really a big network at UCL of top quality research that we encourage our students to really take advantage of while they're at UCL. And we are also trying to train them to communicate their research and their knowledge in the best possible way to their peers and in academic departments, wherever they're based for their research projects. So we really hope that if you join our course, you'll have this opportunity as well to really be immersed in the research and clinical world that is first class at UCL.
So thanks, everybody. So we that's the end of our sort of more formal presentation for you all. And at this point, we'll stop the recording, which you'll hear in a second. Yep. Then we will be able to take some questions from you all if there's anything that you'd like to ask us.